Hello everyone. It's Dr. Vidal and we are back with Tuesday Tips. This is our weekly check-in. We try to meet every Tuesday afternoon and go over different topics in plastic surgery, and I get to answer your questions. Today we have a special topic because I'm very excited to let you all know that we just opened the Pure Aesthetic Center. We've been doing a lot of surgical procedures for a long time now, but we are expanding our non-surgical options. So this is very exciting news, and for all our Pure patients, there's going to be some good things in the works. So check your emails because there's going to be some specials coming up, and it's very important that you go to do your non-surgical needs with an experienced person as well. Okay. Similar to surgical procedures, the non-surgical are like everything in the aesthetic world has been expanding. And we see a lot of people offering different services, but we need to remind ourselves that these are still procedures, that they have complications. And I want to go over all of those things so you understand, and so you understand what you're going through, but also choose an experienced and also the right provider to get the treatments for you, and that way you have your best results and also decrease your complications. Okay, so what are the things that we have available in the non-surgical world? So neuromodulators first. Those are what we call Botox, Dysport. There are other brands out there. These are the ones that we have here available. So what are neuromodulators? We hear a lot of the Botox and then filler. I have some lines, I want them to go away. What do I need? Botox, fillers, what is this? So very simple. A neuromodulator basically paralyzes muscle. So it doesn't get rid of, but just decreases the appearance of lines by relaxing the muscle. Okay, so what are the areas commonly treated with neuromodulators? The forehead, the area between your eyebrows, and the area, what we call the crow's feet, or the area around the eyes. Okay, those areas, we have the frontalis muscles, which is two large muscles in our forehead that basically causes eyebrow elevation and creates those lines that we see with aging. The two muscles that are here in between the eyebrows are the procerus and the corrugators, which makes those 11 lines, or the matte lines, that get deep and more pronounced as we age. And the orbicularis oculi, or the muscle around our eye, creates those crow's feet, or those lines around our eyes. Those are the three most common areas, but neuromodulators have a lot of other indications and areas that we can treat to soften lines in our face. Of those three that are the most common, I think the one that is getting more and more popular is the depressor anguli oris, which is the muscle right in the corner of our mouth that brings the mouth down. So if we paralyze those two, the corners of the mouth kind of go up a little, and it's a very cool use of the neuromodulator because it gives you that refreshed look in the mouth. It is something that you have to get used to, especially in the mouth, because you're going to feel, especially the first time you do it and the first few weeks after you do it, a little weird when you're smiling. Nothing that no one is going to notice, but you notice because the muscle here is paralyzed. But so it takes a little bit to get used to. The other area that is good to use is what we call the bunny lines. So the lines that form here in the side of our nose when we're animating, those can be also paralyzed with Botox or Dysport, or any other neuromodulators, and also the area of the cheeks. So we have the masseter muscle, or the muscle, one of the biggest muscles of mastication. And there are some people with TMJ problems, or just have very pronounced masseter muscles, which are here and makes your jawline or your cheek square. So if you do have overreactive or wide masseters, you are also a candidate to put some neuromodulators that thins the muscle and thins your face. What else? Platysma, which is the muscle of the neck, may cause lines in the neck, so it's an area where we can use neuromodulators as well. So if like we usually hear it for the forehead, for these lines and the eyes, but there are a lot of different uses. Depends on what is it that you dislike or want to improve in your face. The other use is for chronic migraines. It's FDA approved for chronic migraines, FDA approved for also for tension headaches, okay? So, and for excessive sweating. So a lot of different uses that can help you depending on your needs, okay? Fillers. Fillers, as the word suggests, fills, okay? So it adds volume. So at the neuromodulator paralyzes muscle, the fillers add volume. So the areas that you treat are different because they do different things, right? So fillers, the two most common that we see are the hyaluronic acid fillers, which I think are very versatile and can be used in a very different, in basically the entire face, even in the hands for rejuvenation of the hand. So hyaluronic acid fillers are a very good alternative. And the two brands that we have here at the Peristaltic Center is Restylane and Juvederm. And in those two lines, we have a lot of different products, okay? So Juvederm has the Voluma, Velour, it has Ultra, Restylane, we have Restylane Kiss, Soft, Silk, there are different types. And the differences in all those different names, why are there so many? So the consistency of the molecule is different. So the thicker the filler, the deeper you inject it, because it actually creates more support. So the thicker the filler, usually we go to the cheeks, we go to the jawline where the bone is. The thinner or softer, we want to go more superficial. So maybe the lips, maybe the under eyes, the temples, areas that you don't need that much support, and it's more superficial to get rid of those lines. So very versatile in the areas that we want to use. The good thing about fillers is that they're dissolvable. So if we end up with any complications, what are the complications? The most feared complications of fillers, even though people think that, oh, I'm just getting, my nails done, I'm just getting a filler. No, it is still a procedure and it has complications, and that's why we need to go with an experienced injector, okay? And someone qualified and well trained, okay? Our two providers here, other obviously than myself, but with the Pure Aesthetic Center, we have a nurse practitioner and our PA, Jenny and Natalie. They're both great, well trained, and they know their products and they know their anatomy and what they're doing, okay? So that's very important, okay? So the problem with the filler is if it goes into a blood vessel, it can create an occlusion, so the blood flow doesn't reach. And if the blood flow doesn't reach, it can cause skin necrosis, okay? So it's very important that you go with an experienced injector that knows where you're injecting, okay? And if it can go to the skin level and causes skin necrosis, and the other complication, depending on the area, especially around the nose and around the eyes, it can go to one of the blood vessels that goes to your eye and causes blindness. These complications are extremely rare, okay? I don't want to cause fear or put doubt in your head, but I just explaining the possible complications so you understand that it is procedure and you need to go with an experienced person. The good thing is that hyaluronic acid fillers are, like I said, dissolvable. It's a product, it's a molecule that is in our body, okay? We have collagen, we have hyaluronic acid in our skin, and the hyaluronic acid is the same component. So there's an enzyme that metabolizes hyaluronic acid, and it's called hyaluronidase. Oh my God, I had a little bit of a stroke. So that enzyme breaks the hyaluronic acid. So if we have an occlusion causing skin necrosis or any other problem, we can inject this enzyme and dissolve the product. And if you had previously tried hyaluronic acid and you are unhappy with the appearance of it, or you want less volume, then we can also inject the enzyme and break the product and re-inject. That's something that is sometimes needed to improve the results, okay? So Sculptra is another product that we have. Sculptra, it's a filler, but it's not hyaluronic acid. It is more, it creates more of a collagen formation. So it's very good for deeper areas around the chin, around the cheeks to improve collagen formation. Avali is another, it's a different product that we have. Avali is for our cellulite treatment. It's a very good alternative for the buttock and hip area and also the thighs. If you do have cellulite, it's a small incision. We can do it in the clinic. We can also do it in the operating room if you're combining it with other procedures. But it can be done in the clinic side. Small incision with local anesthetic and basically getting rid of those septae or bands that are causing the cellulite. Morpheus 8 is it's a device that gives radio frequency energy combined with the needles. Depending on the area that we're treating, it's giving radio frequency energy to the tissues, and it optimizes skin tightening, appearance of fine lines, and collagen formation. So it's very, very good for the face, for the neck, and also comes Morpheus 8 body, which is a little bit of a bigger cartridge that you put in the device, and you can use it for the belly, for the thighs, for the buttock, for other areas. Okay. IPL laser, it's very good for treating like small areas of hyperpigmentation in the skin or areas of sun damage. So if you have problems with hyperpigmentation in your skin, you may consider doing IPL laser. And plasma. Plasma is using your own blood. So we take a sample of your blood, we centrifuge it, separate the different layers of the blood, and we get plasma. Plasma is a part of your blood that has nutrients and have enzymes, and that's re-injected with microneedling to improve collagen formation, reduce the appearance of small lines, and skin tightening. So all of these things are very, very good. So if you want to get an evaluation, it's very easy. Just give us a call or go to our website, request consultation. Let us know what are your areas of concerns, and we can definitely book you for an appointment with us in the Pure Aesthetic Center. I'll take some questions now if you guys have it.
First question, Doc. Do you do implant exchange? Explanation.
Yes, I definitely do. Implant exchange is a very common procedure that I do. Depends on what is your goal, if you want to go big or smaller. If you want to go smaller, most of the time you'll need a breast lift, okay? So things to consider, but definitely if you want to have an evaluation, the website is the easiest. Request consultation, go there, fill the form, send me your pictures.
I don't do well narcotics. Can we opt for the strongest form of Tylenol after surgery?
Definitely, we can do combination treatment for pain management after surgery. Unfortunately, Tylenol just has a max amount of Tylenol, of acetaminophen, that you can take in a 24-hour period. So we can do extra strength, but there's a max of 4,000 milligrams that you can take in a 24-hour period. So if you don't want to take narcotics, we can do other combinations of like muscle relaxers and gabapentin to try to decrease your pain. But I always prescribe the narcotics just in case, okay? I don't want you to be at 2 a.m. with pain and not have it available in case you need it.
Hi, Dr. V. I'm having a BBL procedure on May 31st with you,
Awesome.
but I want to know how long does it last? The results.
Yes. Oh, so the results are permanent in a sense because it's your own fat, but they are going to change with your changes in weight and lifestyle and with aging, okay? So a BBL is taking fat from your belly, from your back, and transferring it to the buttock and hips. That fat that is transferred needs to build its own blood vessels there. So there's a period of time, and that's why for the first 6 weeks, you shouldn't put pressure on it. You shouldn't sit, you have to sleep in your belly. Because that period of time is when the new blood vessels are growing to basically create the new roots for that fat to survive in the buttock and hip area. Once that fat survives, usually you lose approximately 20 to 30% of that fat in this process. But once that fat is settled, after those first 6 weeks to 3 months of surgery, that fat is yours. The only thing is, if you lose weight, that's going to decrease. If you gain weight, that's going to increase. Same as if you fluctuate in weight, your belly fat will fluctuate.
¿Qué tiempo debe durar en Miami después de un tummy tuck o qué tiempo recomienda? Y si la podemos hacer bilingüe para los...
Seguro que sí. El tiempo aquí en Miami es más o menos una semana. Yo te voy a ver el día antes de la cirugía, luego el día de la cirugía y luego te voy a ver a los 5 días postoperatorios. O sea que más o menos, depende de si cae fin de semana, entre medio o no, es más o menos una semana aquí en Miami. Luego de que yo te veo es al 5.º día postoperatorio, si está todo bien, ya puedes irte de vuelta a la casa. So the question was, if how long do I need to stay in Miami if I'm getting a procedure and you don't live here? So it's usually around a week, okay? So I'm seeing you the day before the surgery, okay, for your pre-op appointment. You come the day before, the day of surgery, and then post-op day 5, I see you here in the office, okay? After that visit, if everything is okay, then you're cleared to go back home.
Okay. Do you perform reverse tummy tuck? How's the surgery? Is the incisions under your breast?
Yes, so that is a reverse tummy tuck. So a reverse tummy tuck is, instead of pulling the belly down and having the scar down, is pulling it up, okay? So the scar is hidden below your breast. So similar to a breast lift type of scar that goes in the fold of the breast. The only difference is most of the time I have to connect them to kind of get a good pull, especially in the center, okay? But yeah, it's hidden in the inferior part of the breast where the fold is. The only difference is I don't reposition the belly button, okay? So it is, if you have loose skin under the belly button, that is not a good procedure for you. It's only for people that have a very flat belly under it and just have a little bit of skin hooding or kind of excess over the belly button, and then you pull that skin up to create a better contour.
Things we should buy before breast lift with augmentation.
So there's going to be a list given to you with all the things that you would need to bring. So don't worry about that. But usually things like gauzes, things like Tylenol, having stool softeners, having adequate hydration so you're prepared, pads in case you need to pad in the area. But with a breast lift augmentation, we're gonna give you the bra in case you don't have to worry about that. You're gonna use that bra for the first week. I don't recommend buying any bras until after surgery because you're not gonna know what size you are, okay? So you'll need to see and measure yourself after the surgery to order the correct size for you.
Do you offer any medication for nerves prior to surgery? I'm very nervous about my surgery.
I don't. Feeling nervous about surgery is completely normal. I haven't seen one patient that hasn't told me I'm nervous. That's completely normal and expected. But if you do have anxiety, I do recommend you going to your primary care and getting a prescription to manage your anxiety.
Okay. Weight training post BBL. How and when? I'm 6 weeks post.
So 6 weeks after surgery, you're cleared, okay? So if everything is healed, you're cleared to go back to the gym. Obviously, you haven't been working out for 6 weeks, so try to take it easy, progressively, listen to your body. Check how you're doing. Obviously, you're not gonna start with the weight that you were doing before. You're gonna start maybe halfway, and then see how you're doing, okay? There are no contraindications unless you have any open wounds or anything that hasn't healed, but if everything is healed, you're clear to work out. With the BBL, remember, your weight training is more important than your cardio, okay? We don't want to burn the fat. We want to build the muscle underneath to strengthen and support the fat transfer to improve your results.
Okay, this question is for a mommy makeover patient. And she asks, for mommy makeover recovery, how long until I can carry my 10-month-old? She weighs under 20 pounds.
So unfortunately, you'll have to wait 6 weeks, okay? So 6 weeks until you can lift anything heavier than 10 pounds, okay? The reason for that is because of the muscle repair and the incisions. We want everything healed and straightened, and that scar tends to form at up to 6 weeks, okay? So wait until 6 weeks. What things you can do after a mommy makeover, because I know that you want to grab your baby, you can sit and have someone put him in your lap. Those things you can do, just not pulling up and creating that force in your core. Awesome, you guys. Thank you so much for the questions. I hope this helped answer some questions. Give us a call if you're interested, and I'll see you guys next week with Tuesday Tips.